Chapter 17, Development of the Human Eye, page number 636. Schlemm's Canal. Schlemm's Canal develops from a small plexus of venous canaliculi by the end of the third month of gestation. These channels are derived from mesodermal mesenchyme and initially they function as blood vessels. Whether they arise in situ between the developing sclera and trabecular meshwork or are derived initially as blind endings of extensions from the deep scleral plexus of vessels remains open to question. However, the vascular nature of the channels and of the fully developed Schlemm's canal is now confirmed from the demonstration of Weber pellet bodies and factor VIII related antigen in the living endothelial cells. The presumptive canal of Schlemm has several points of origin around the circumference of the inner limbus, and the characteristic single canal is formed by a process of anastomosis. The endothelial cells that line the canal of Schlemm are joined by zonuli occludentis junctional complexes. During the fourth month, the canal is surrounded by other mesenchymal cells that secrete and are enmeshed in basal lamina-like material and foci of collagen fibrils. Eventually, this tissue forms the juxtacanalicular region, which remains loosely organized toward the trabecular meshwork. At about the beginning of the fifth month, characteristic vacuolar configurations begin to appear in the endothelial cells lining Schlemm's canal, and the vacuolar configurations represent stages in the cyclical formation of transcellular channels that allow for the bulk outflow of aqueous humor across the endothelial barrier. The development of macrovacuoles corresponds to the time of differentiation of the ciliary processes and the onset of the circulation of aqueous humor. The canal of Schlemm now functions as an aqueous silus rather than as a blood vessel. Up to 6 months of gestation, both Schlemm's canal and the scleral spur are located posterior to the deepest part of the angle of the anterior chamber. But by 7 months, the angle has receded to the level of the canal. Ultimately, because of growth of surrounding structures, the canal comes to lie at the apex of the angle and is limited posteriorly by the scleral road. Figure 17.24. The angular region of a 12-week-old human fetal eye showing a series of venous canaliculi at arrows at the junction of the enlarge of trabecular meshwork (TM) and the dense corneoscleral tissue at top, which designate the beginning of the development of Schlemm's canal. AC stands for anterior chamber, IM for iris stroma mesenchyme. Transmission electron micrograph, original magnification 1110 times. Figure 17.25. At 22 weeks of gestation, Schlemm's canal SC is well developed as a single channel. The endothelial lining of its inner wall shows vacuolar configurations, arrowheads, which function in the bulk outflow of aqueous humor across the intact cellular barrier. TM stands for corneoscleral trabecular meshwork. Transmission electron micrograph, original magnification 1110 times. Thank you.